The intent of the following presentation is to address whether or not the consumption of energy drinks results in any cardiovascular effects or changes. We chose this topic because many college students consume caffeine on a daily basis. Even Toro provides its students with an endless supply of something that vaguely resembles really weird coffee. Energy drinks contain additional ingredients that are supposed to give you an energy boost on top of the caffeine buzz. Given that energy drinks are ever so popular in today's society, and it seems like we all know someone whose brother, sister's, mother-in-law's husband had a heart attack from drinking 12 Red Bulls a day, we sought out some research studies on the topic to know just how and if energy drink consumption affects cardiac function, so there can be guidelines on proper consumption.
So as Tasha said, energy drinks are a ubiquitous beverage at university and school campuses. And even though you don't consume them, many of your patients likely will. So it's important for us to learn how to evaluate the quality of the studies that are assessing the risks and benefits of these beverages. So our first one, we had a case where we took a look at a randomized control trial of energy drinks versus coffee and how they affect the heart rate, blood pressure, and EKG of the participants. And then next we did a randomized crossover study where we looked specifically at Red Bull and its effects on the heart and brain of young people. And then finally, we took a look at an open randomized control trial of energy drinks in general and looking at blood pressure, heart rate, and blood glucose in young adults.
The object of this first study was to see if energy drinks had any effects on EKG and blood pressure compared to caffeine drinks. So the experimenters designed a randomized, double-blind, caffeine-controlled crossover study. There were 18 participants in the experiment. They were selected from a U.S. Air Force base. They were considered healthy between the ages of 18 and 40. So these 18 participants were split into two groups. One would drink the caffeine drink first, the other would drink the energy drink first. So prior to this experiment, both groups fasted for 12 hours and did not consume caffeine 48 hours before the study started. So during the experiment, both groups drank their assigned drink. They waited 6 days and then drank the other drink. Both drinks were drank over a 45-minute period. Both contained 320 milligrams of caffeine. The control drink only contained caffeine and no extra ingredients that were supposed to have any effects on the experiment. And the energy drink also had 320 milligrams of caffeine, but had extra ingredients that were supposed to boost participants' energy. So measurements were obtained at baseline, 1, 2, 4, 6, and 24 hours after drinking both drinks. The measurements that were taken were for QTC, QT interval, PR interval, QRS duration, heart rate, central systolic and diastolic blood pressures, peripheral systolic and diastolic blood pressures, and there was also an augmentation index which corrected each participant's measurements to a standard of 75 heartbeats per minute. Also during each measurement point, participants were asked to describe any negative effects they were experiencing during the experiment.
The data analysis for the first study was done by using a Wilcoxon signed ring test. And overall, the researchers concluded that the corrected QT and systolic BP were higher after the participants drank the energy drinks rather than just drinking caffeine alone. Some of the biases include not using the same number of male and female participants, and they also focused on a very specific population, with most of the participants being in their mid-20s. They also didn't look at different ingredients within these drinks that were consumed, which have been shown to skew the QT and systolic BP. So this is a future study that needs to be done to strengthen their data. They also didn't look at chronic use, so rather they focused on the short term. Some of the strengths include that the study was double blind and it looked at changes in the ECG, heart rate, and blood pressure at 6 different time points, which is different than other studies that have been done.
The second study is titled Cardio and Cerebrovascular Responses to the Energy Drink Red Bull in Young Adults. This study is a randomized crossover study in which researchers had subjects drink Red Bull to determine its acute effects on cardiovascular and hemodynamic variables, as well as cerebrovascular parameters and microvascular endothelial function. The study was conducted using 25 healthy subjects, 12 of which were women and 13 which were men, and they were all within the ages 20 to 31. They were monitored on 2 separate occasions in a university setting. Each time, the subject would drink either 355 milliliters of Red Bull or 355 milliliters of tap water. The methods used were clinical data, such as a baseline blood pressure, cardiography, and endothelial function test. These were performed both prior to the consumption and after the consumption of these beverages. The results of the study showed that Red Bull led to an increase in both systolic and diastolic blood pressure, increased heart rate, and cardiac output. No change was noted when consuming just plain water. When doubling the load, there was also an increase in cerebrovascular resistance and decrease in blood flow velocity. The data analysis was done using a 2-way ANOVA and a paired t-test. The conclusion of the study determines that Red Bull's effect on cardiovascular systems showed a negative hemodynamic profile and elevated blood pressure when compared to the consumption of water. Our group's critique of the study, we felt that overall the study was easy to follow and the methods were very clear. However, we feel as if the study could be biased because of the other ingredients contained in Red Bull. These could have contributed to the effects and not just the caffeine. We also feel that using microvascular endothelial function testing versus flow-mediated dilation like previous studies, excluding it as a factor for the increase in blood pressure. The strengths of this study were that they were performed continuous blood pressure monitoring on the subjects, and it was the first study documenting the cerebral blood flow velocity in response to Red Bull consumption.
The third study that we chose was a paper titled The Effect of Acute Consumption of Energy Drinks on Blood Pressure, Heart Rate, and Blood Glucose in the group of young adults. And this was an open randomized control trial. Open meaning that each subject and each experimenter knew which experimental group the subject belonged. So if the subject was in the group in this study that was given an energy drink, then they knew they were getting an energy drink. And if the subject was in the group that was getting the spring water placebo, they knew they were getting a spring water placebo. And so the background of this is that they were comparing, we'll get to that later. The number of participants, this was a sample of 68 healthy adult volunteers, 53 were female and 15 were male. And this was in a community setting. The sample was pulled from what was described as students from a private university in Poland. And the methods used was the collection of clinical data or biometric data, including systolic and diastolic blood pressures, heart rate, and blood glucose. And they were taking these biometric data, or measurements prior and after treatment, which was either given a energy drink or a spring water placebo. So the data analysis here, the results were statistically analyzed by calculating the mean and standard deviation. And then each biometric category, again being blood pressure, heart rate, and blood glucose, was assessed for variance using a one-way ANOVA. So after that, each biometric category between the two experimental groups were compared for statistical difference using Tukey's honestly significant difference post hoc test. And the p-values, the p-value threshold selected for this study was lower than 0.05 to be considered significant. So the conclusions were that the consumption of energy drinks contributes to an increase in diastolic blood pressure and blood glucose in the young, healthy individual in comparison to a placebo. They did not see a significant effect or increase on systolic blood pressure or heart rate. So one of the biases that were identified was that, again, the study was not blinded. Each subject knew what group they belonged to. And also there were substantially more females represented in the sample than males. One of the strengths, however, was that the researchers were sure to, they made special consideration of known cardiovascular disease and how it could have a confounding effect on the results. And so those people were screened and were excluded.
The first study was closest at answering our research question, since it studied highly caffeinated drinks versus energy drinks containing all different additives. This one study, though, is not enough to make an informed decision either way in regards to our question. The second and third studies we chose targeted a student population, yet the study designs presented limitations. The second study focused on Red Bull consumption, which is a popular energy drink choice, but it contains many additives and which makes many variables with limited data. The third study showed that minimal cardiovascular effects were noted, which contradicts the findings in the first two studies. There has not been enough research conducted to effectively give us an answer on the effect of energy drinks on cardiovascular health. There needs to be more research on the additives in energy drinks and how that interacts with the high caffeine content, a point mentioned in both of the other two articles we cited for our question. One conclusion amongst all three studies is that the consumption of energy drinks does show a possible negative physiological effect on blood pressure in young, previously healthy individuals. Each study saw a variation of other negative cardiovascular facets, but there is not enough research in each of these areas to speak to a conclusion. So a look towards the future would be studying the interaction between the additives of energy drinks and the high caffeine intake, studying the physiological effect of additives used in energy drinks together, physiological effects of energy drinks in an unstressed versus stressed environment, such as students versus less of a stressful environment, and then studying the long-term effects of consistent energy drink use.
All right, guys, it was great working with you guys on this project. I really appreciate everybody's hard work. And Michelle, thanks very much for taking the minutes. Is there anything else we need to cover?
Oh no, my pen died. So does anyone have one?
It's on its way, Michelle. Hold tight.
Thanks, guys.
Here you go, Michelle.
Yay, thanks, guys. Woo!
Woo! Teamwork.
See you next time.